What an exciting climb to the top. I'm now joined by Dr. Tony Brenningstool, Chief Medical Officer for American Physician Partners. Founded in 2015, the Brentwood-based firm provides physician management services for hospitals and health systems. And in just 4 years, the company soared to $440 million in revenue and 2,700 employees in 2019. Thank you, Tony, for being with us today.
Thank you. It's my privilege.
So this year marks American Physician Partners' debut on the MBJ's list of the fastest growing private companies, and what an incredible growth story that you have to tell. What are the primary factors driving your company's early growth?
As I think about that, I don't know if I can single out any one specific strategy we've had that's allowed us to grow this way. I think largely it's come from our passion for serving and our commitment to creating excellence in the patient care experience in the emergency department of hospital medicine where we serve. And there's a real need in the hospital community for a management company like ours who really partners with our hospital administrators to deliver excellence in the patient experience. And I think because we've been able to do that and really execute in that arena has led to word of mouth recommendations, and it's certainly led to our tremendous growth.
And so as the company has grown rapidly, what's been your most important decision?
Maintaining our culture. I think for us, as we continue to grow, we have a tremendous culture here. I think all of our 2,500 plus physicians that work with American Physician Partners and our 100 plus employees here at the Practice Support Center are all committed to excellence. We believe that we want to set the standard for excellence in the patient experience, and we have created a culture that's very much like a family here, where we are all chasing excellence together. And I think that for us, as we have grown and added and onboarded and trained new leaders, new directors, new department leaders, and more people within each of those departments to execute the tasks, it was critically important to John and I to make sure that our culture remained at the heart of everything we do, and that our vision for excellence and exceeding the expectations for our patients, our providers, and our hospital partners remains paramount in the mind of all of our employees.
So your company boasts a 100% client retention rate. How do you accomplish that?
I'm amazed at that at times. I'm very humble and proud of what our team has accomplished. We have never lost a contract. We've not ever disappointed a hospital or a community that we've been privileged to serve in. But that's from leadership execution. It's from our commitment to purpose and for our desire to serve and lead well in the communities where we are. And I do think our unique structure of how we create our DIAD regional leadership team and how we build our medical directors and support and resource them so that they can lead well at the facility, and then how we limit the number of facilities that each one of our leadership units are responsible for really allows us to have very reproducible and consistent engagement at each of our facilities. And I think that's what's been a secret to our success.
So since your formation in 2015, how has your pitch to potential clients changed, and how might it continue to change going forward?
I don't think we will change. I think, we've built our company on very, very specific principles around leadership, around teamwork, and around creating a unified team with a patient-centered focus. And that's who we are, and we're committed to that. As you heard me share our vision statement about exceeding expectations for the patients we serve, for the providers who are part of our team, and for our hospital partners we have the privilege to work with, is what we're committed to doing every day. And so that is who we are, that's what we do, and I think our success has been driven by our ability to reproduce that in 18 states and in 160 different programs. But that's who we are, and we're proud of who we are, and we'll continue to make sure that we deliver that same level of service to each partnership that we have.
And so from your perspective, what's the biggest challenge for healthcare providers as they continue to navigate COVID-19?
That is a great question. And, first I want to thank all of our providers, because as you know, in our area of specialization, we're on the front lines battling the COVID-19 pandemic every single day. And so we have 2,500 plus heroes that are every day at the bedside working to make sure we deliver premium care in a compassionate and courteous way to every patient that we serve. And COVID-19 is a tremendous challenge, but it's also a tremendous opportunity to lead well and a tremendous opportunity to serve well. And I'm so proud of our team who have really taken this responsibility to heart and are charging forward, saying we're going to lead the way in how we provide safe, effective, and compassionate care during this pandemic and this crisis. And so really proud of what our team has done, really proud of what our team has accomplished. But also, this is sort of our Super Bowl. This is what we do in emergency medicine. We were built for this, and our team takes great pride in being able to rise to the occasion and again lead well and serve well during this incredibly challenging time. But I think for John and I and our leadership team, what we want to make sure that we're doing is making sure that our team has the resources that they need, that they have the ability to sustain that ongoing performance in the face of the challenges that we're in. And so we work very hard on our culture. We work hard to make sure that we give our team the resources that they need to be able to create that sustained effort. And then what we do with our leaders to make sure that they have the tools they need. So we're delivering best in class and best practice processes to our departments as this continues to evolve and unfold. And I just look back and I think that we're doing a tremendous job managing this pandemic, and it's because of the unification we have within our team, the singular commitment to excellence, and certainly with the expertise that we have all across American Physician Partners, and the courage that our team has to really say, this is our chance to lead well and serve well, and we're just incredibly proud to be able to do that.
So where are your company's next areas of opportunity?
So we've been asked to grow in some new areas. So intensive care medicine is one. We call that critical care. And then certainly in our hospitalist medicine division, we've grown. So we started as an emergency medicine-based company, but as we've done a great job for our hospitals in those areas, they've asked us to take on these other areas of specialization, which we have done. We've added tremendous expertise to our team. Dr. Dennis Terrell leads he's our executive medical director for hospitalist medicine and critical care, does a great job with us leading in quality in that area. And so I think that our goal is to not change from who we are, but to continue to serve our hospital partners in ways that they need and that help allow us to create that backbone of services that allow their hospital to be differentiated and really become the hospital choice in the community that they are in.
And so where do you see American Physician Partners in the next 5 years?
It's a great question. As I look back on this 5 years, we just celebrated our 5-year anniversary. I look at the tremendous growth we've had in this 5 years. I think none of us predicted that this would happen, but it's the result of quality and execution. And I think as I look to where we go forward, we humbly want to just be recognized as one of the best in the business. We want to make sure we're an industry leader around quality, around excellence in the patient experience, and around bringing a partnership level of engagement to our hospitals that's different and not represented in the market today. And so I think when I see us 5 years from now, I think we're going to continue to grow. At this pace will be extraordinary, but I think that we are going to continue to enjoy successes of more partnerships, growing within our hospital systems, and continuing to serve well in the communities where we're selected to be.
Well, that certainly will be exciting to watch. Thank you, Tony, for spending time with us today.
Thank you very much. And again, let me just say thank you on behalf of all of our American Physician Partners team on receiving this recognition from you. And thank you for the opportunity to be with you today.
Well, congratulations to you and to all of our Fast 50.